Welcome to episode 29 of Reverse the Relapse. And today I have a very special guest for you. We have a weight loss surgery surgeon on today where we are unpacking the weight loss surgery journey. You're in the right place if you're ready to stop the sabotage and weight regain post-weight loss surgery and start losing again. Hi, I'm Georgie Beams. I'm a psychologist who specialises in the area of emotional eating, sabotage, and weight regain for weight loss surgery patients. I work both in a weight loss surgery clinic as well as supporting women online to reverse the relapse. I honestly believe that psychology should be a mandatory part of everyone's weight loss surgery journey. Your body has had an upgrade to version 2.0 after surgery, but your mind has been operating at version 1.0. You're here to update your mind to match your body and get back on your weight loss path, and I'm here to help you. So today we have Michael He, and Michael is an esophageal, it's always a hard word to say, and bariatric surgeon at Melbourne Gastro Osphoegeal surgery. Michael is one of the best weight loss surgery surgeons that I have had the pleasure of working with, and I invited him onto the podcast today for him to share his thoughts and experiences so you can continue to learn. So a big welcome to you, Michael, to the podcast. So let's start with a general question, which is, what is it about weight loss surgery that attracted you to work in this area?
Thank you, Georgie, and thank you very much for having me on your podcast. Great question. So as you know, I do upper GI surgery, which these days means I do surgery of the esophagus and the stomach and weight loss surgery. Now, for me, that means a lot of cancer surgery in the esophagus and stomach part. And it's really a very different kind of surgery to the weight loss surgery side. What that means is weight loss surgery, it's technically challenging and all that's great for a surgeon. But from a patient perspective, you generally get very good results, very fantastic weight loss, quick results, and really some life-changing outcomes, generally in a positive way. And I contrast that to the cancer surgery because whilst the cancer surgery can be very successful, you're really battling a very challenging problem. And sometimes even when the surgery goes great and the surgeon does a good job and the patient does everything correctly, you can still sometimes get not quite the outcome you want. And for that reason, I really love the kind of almost refreshing nature of the weight loss surgery. From a technical perspective, they're great operations. And I also really like how performance in weight loss surgery is rewarded by outcome. And what that means is if the surgeon does a good job, the team does a good job, and also the patients, then generally the likelihood you'll get a good outcome is greatly increased. And for me, I like that predictability.
Fantastic. It's always a great question. Actually, I've had quite a few of our patients ask specifically around why you work in this area. So it was really good to know that too. So thank you. So next question, and this is an important one, which many of our listeners will really be wanting to know the answer, which is you've seen the whole gamut, different cases, different patients, different surgeries, the whole life cycle. You've seen those who do exceptionally well after weight loss surgery, and you see those weight loss surgery patients that don't do as well and they're sabotaging their results and outcomes. So in your opinion, what's the key difference between those that quote unquote succeed and those who quote unquote fail?
Yeah, thanks, George. That's another great question. And you're right, so many of our clients do ask us about that, don't they? And I guess the challenging thing is that there is still a degree of unpredictability in what happens after weight loss surgery. As you're aware, we take really comprehensive histories, we go through a comprehensive workup, and patients often see almost all the members of the team prior to surgery to try and work out how we can streamline the process and push them towards that success path The things that I've found that really seem to differentiate people relate to effort, and that's a pretty broad term, but people do have a varying capacity to put in effort to try and get the best outcomes for themselves after this sort of surgery, and that really relates to a lot of different areas. So preoperatively, when you speak to people, again, you'll know this yourself, Georgie, but some people really have researched every little thing about every single operation and understand or have a really good understanding of what they're getting themselves into. And I think that actually helps a lot. We certainly encourage people to do internet research, speak to their friends, speak to their colleagues, get on all the Facebook groups. And I think having an understanding of where you want to go is probably the first step. During the process and after surgery, of course, there's a huge amount of effort that can go on with respect to further learning. What does that mean? That means, in the first month post-surgery, you're just getting used to how things might sit. That changes in the second month, that changes in the third month, and people obviously have a different ability to put in effort. They have a different capacity with respect to the supports they're getting from around them. Everyone's obviously got life to live still, so, as you and I both know, having kids running around often distracts you and takes time away from what you can do for yourself. And again, that can make a big difference to eventual outcome, I think. I guess the other big point I would touch on is the willingness of people to change in the long term. Obviously, around surgery, things are exciting, things are new. It's kind of almost like a fun game. But in the long term, obviously, some subtle changes, or for some people even some big changes, are important to make sure you get the best outcomes from surgery, and people's willingness to engage in that. And obviously that's where you come into play a lot, Georgie, but people's willingness to do that is quite varied.
Yeah, fantastic. I think you've raised, some really good points, and I see that too with the patients that I see, in terms of their outcomes can also be around that willingness to change and do the work that's required to get the results that they're after. So let's talk about weight regain. This, I think, is something that many listeners might either be concerned about in the future or are feeling frustrated about right now if that's happening to them. So when does weight regain typically become an issue, and why does this become an issue?
Well, George, I think this is a good question for us to have a bit of a conversation about, and I think there's a lot that I could learn from you here as well. From a physical perspective, what we expect is that a lot of people post-surgery, and possibly even most people, will gain a bit of weight, and we expect that to be around year 2 or the end of year 2. I always tell people that the weight loss trajectory, if you smooth it out, is kind of like a backwards tick. Everyone will lose weight fairly quickly at the start. It'll hit a plateau, and then almost everyone has a little uptick at the end. Why does this happen? Well, it happens for lots of different reasons. The biggest thing I think is that because, life goes on in spite of surgery. Again, at the start, in the first year or two after surgery, things are pretty exciting, and it's easier to put in a lot of effort, isn't it, to try and get the outcomes you want. But as you get away from surgery and as life starts to return back to normal, some of those old behaviours can sneak back in. I guess the biggest physical traps for me are things around food choice, appetite and portion size. I guess that's pretty obvious if you think about it, but what we really encourage people to do is avoid processed food, high sugar food, high fat food, and we really, in an ideal world, would love people to set themselves up so that they prepare a lot more fresh and home-cooked food in the long term. I think as surgery progresses, there's a tendency to reduce the amount of vegetable intake that people will consume on a sort of routine basis. There's a lot of focus around protein, which is really important, but it's also important for me to remember that protein is really just one macronutrient. And getting a breadth of vegetable matter in is important to keep your calorie count down, to keep your nutritional breadth up. That means getting a lot of different micronutrients, minerals and vitamins. And also the vegetable matter really is the stuff that's going to look after your microbiome, the bugs in your gut, which control a lot of your metabolism. And I think a lot of people forget that as time passes. The third real critical trap is alcohol people sort of forget about alcohol, but it's hugely calorie dense alcohol, and certainly more so than most other things. So a few drinks really can add up to a lot of weight gain if it's just a few drinks regularly. There's a huge psychological piece, Georgie, and I don't know if this is the right time to talk about it, but we do seem to see kind of challenging behaviours at that time. Things start to rear their head at that time, which is why we encourage long-term follow-up and support. We certainly like our clients to come back at least yearly, even in the long term. And sometimes we can see sort of behaviours sneaking back in that we'd like to deal with, and that's often why we end up sending patients to see you, Georgie, at that time.
Yes, and I've noticed that I'm seeing a lot of patients after surgery, anywhere from 6 months post-surgery, not even 2 years out. Are you finding that as well? That I know you mentioned 2 years, but I'm seeing this honeymoon period really start to wear off, even sort of 6 months, sometimes even 4 months in, which is, I mean, you go through such that big process to prepare for the surgery, all the investment in all areas of your life, the changes, and then 4 months later to maybe start to have the head hunger increase, those bad eating habits start to sneak back in. Did you want to sort of comment on that?
Yeah, I guess in a way I'm sort of pleased you're noticing that. There's sort of two ways to think about the psychology from us on a surgical side. You may remember this, but at the start of sort of bariatric surgery becoming a popular surgery, particularly in this country, there was sort of a feeling that patients had to see the psychologist prior to surgery, be screened for surgery, and part of that was trying to select patients that would do well and wouldn't do well, and some people would be excluded from surgery. That was really, really particularly common right at the kind of top of the band era. Now, a lot of time has passed since then, and there's been a lot of research that really sort of proves that no one can really pick with a great degree of accuracy who's going to succeed and who's going to fail using those sort of broad terms with surgery. However, I'm finding more and more, and I'm trying to push people more and more towards early psychological input, because I think it's really a lot better to kind of identify problems early, identify different strategies to deal with them, such that the psychological things we see never translate into physical, and in this case, weight problems. I really, really prefer people to be able to see those, work on them, and have those kind of strategies ready to go in their pocket for any stressors or situations that arise along the weight loss surgery journey, rather than kind of waiting till they see a bit of weight regain, noticing there's a problem, and then trying to deal with it. Because as you know, George, after the sort of 2 year period, if there's a substantial amount of weight regain, that really becomes pretty tricky to deal with.
And we've got a great team in the clinic, and what I love, I've been here since 2016, is that psychology, I feel like a really valued member of the team. And it's seen from all the team members as being, a really important part of the weight loss surgery journey. Not everyone is so lucky that is listening to this podcast that has such a supportive and maybe robust team. And what I know is there's many listeners that might have regained weight and are avoiding their surgeons and avoiding their team because they feel like a failure, and they feel ashamed, and they feel like they've let their surgeon down, and they no longer, they take themselves out of the process. So they're not going to their checkups, etc. Did you want to comment on that?
Yeah, great point. And that is one of our sort of greatest long-term challenges. I mean, ideally, what we'd love to do in a perfect world where you had all the time in the world would be to do the surgery and really be able to follow up the patients yourself really pretty frequently, which we could do, at the start when there wasn't that many patients. But obviously as time goes on, it becomes entirely impractical, for the surgeon to see patients as much as they'd like, because ideally we'd sort of want to be talking every 3 to 6 weeks. 3 months, maybe 6 weeks to 3 months. So we've got a big team, and we rely really heavily on that team to identify issues, to give encouragement where things are going really well, and really just smooth out the journey. Having said all that, we still really would encourage patients to come back in the long term as much as possible. We want to touch base and make sure they're nutritionally intact. We want to touch base and see how they're going. And if there are problems, we still are here, and we really want to help them or at least point them in the right direction where we can find solutions for some of the problems that arise.
So this particular question I sort of see play out a lot when I see people pre-surgery that are kind of in that bubble where they're a bit excited, and they have a view that when they get surgery, then they'll start to be perfect. You know, like all their problems will solve, they won't sabotage themselves, they'll no longer have that craving for, you know, a cheeseburger or chocolate at night, etc. Thank you for listening to the podcast. If this is resonating with you, I invite you to watch my free training and learn the 3 secrets that every weight loss surgery patient should know before and after surgery. So go to www.georgiebeams.com and you'll find the training link on the home page. So we hear all the time that weight loss surgery is just a tool. So I'd love to hear from you in terms of what did the patients not realize pre-surgery, when they might have been in their excitement bubble, that they learnt after surgery?
Good question, George. So I think the answer to this question really depends on a lot of different scenarios. And for me, for example, where we do surgery here through the private clinic, but also surgery through the public clinic, the client group is a little bit different. So I might answer that today kind of from the perspective of the private clinic patients. Now, private clinic patients, as we sort of alluded to earlier, when they come into this, they've done heaps of reading. I've spoken to so many people. They've been on a lot of the kind of connection groups on the various social media platforms that offer it. So when they come into surgery, they often have a really good understanding. It sometimes even surprises me of, you know, what's going to happen before surgery, what the tests are that they're going to have, how the day of surgery goes. They sort of even really know what the hospital admission is going to be like. It's really quite impressive how much research some people have done. So I don't actually often find that physically there are a lot of surprises for people afterwards. What, for me, is the biggest lesson people seem to learn is actually they learn how their body works, how they respond to sort of various physical sensations, how mindful they are. Being particularly... I'm intentionally avoiding the word willpower here because whilst willpower certainly has a role to play in this whole complex journey, it's sort of a touchy topic, and we've got to remember how much biology is part of the weight loss surgery journey. So yeah, the biggest lesson for me is that people learn how they respond to hunger, how they can deal with hunger, what strategies work for them. And I think that's really quite particular and specific. And similarly, how their body responds to different food types. You know, the thing about, you know, dieting and those kind of the standard weight loss techniques that we've all been exposed to in the past. The thing about those for me is that they're kind of very one size fits all, and it doesn't allow for a lot of adaptability or individual variation. So again, after this sort of surgery, when all those kind of sensations and thoughts and feelings can be kind of exaggerated and emphasized, people are surprised how they in particular respond to surgery.
Great. Yeah, totally understand what you're saying there. So final question, you refer a lot of patients to me in the weight loss surgery clinic, which is fantastic to see as well, that you appreciate the value that a psychologist can bring into the mix. So I'd be really keen to understand, what are the flags that you see that prompts you to send them my way, both pre-surgery and post-surgery? And I'd love our listeners maybe just to be considering if there's anything that they're, resonating with, that maybe that's a sign to sort of seek some psychological help.
Thanks, Georgie. So look, Again, my philosophy on this is sort of evolving, I guess, as you would expect, and I'm a lot more interested in trying to get people to see you prior to surgery these days than in the past. For me, it's actually pretty simple. We have a questionnaire that you've probably seen that all the clients fill out, and I have a conversation with people about whether or not they really perceive emotional eating as part of their long-standing problem. And the reality is it is very, very, very common, as you're very well aware. So my preference is really to engage people with a discussion about that at the time of our initial appointment. And then I always put it to people, look, I think that it would be worthwhile for you to have a chat with a psychologist. My general question is, are you ready? I think going to the psychologist is sort of like going to the personal trainer. If you're willing and ready and you want to engage, then you're going to get a heap of benefit out of it. But if you really don't want to go, then actually it's probably a negative thing. You'll come out of it with a kind of unpleasant sensation and you won't want to move forward. So I put it back to the patient. But I'm really very encouraging and I have a very low threshold for sending people along. My personal aim for the kind of relationship between the client and the psychologist is to develop strategies and to work on strategies and develop non-food related coping mechanisms. And of course, there's an element of selfishness in what I do. I really want our clients to do well and I want to see them do well. And for me, from what I've seen, the people that do engage with the psychology early and get those strategies ready to go, for immediately after surgery, they tend to do a lot better. I mean, it's quite obvious, but if you wait for the problems to occur and then you treat them as they appear, you really are chasing your tail.
And I think the other point is that surgery doesn't fix those long-standing issues. So if so many of our patients have the long-standing history with emotional eating, the yo-yo dieting, starting at a very young age. Surgery doesn't fix everything. And so addressing, why you needed to have surgery and what got you there in the first place is really an important part of the process to change your relationship with food to make your surgery successful.
Yeah, that's right, isn't it? And it's a huge journey, even just coming to the first appointment to see the surgeon. And we know that people usually think about this sort of thing for 3 or 4 years prior to seeing the surgeon. And so going to the psychologist isn't a one visit, you come out and you're cured sort of experience, is it? So again, getting people to see the psychologist early, giving them that time to deal with those issues as you go through the surgical journey is really important. Sometimes you see the surgery kind of hide those issues for a while. I'm sure you see that as well. And in that honeymoon period, as you say, sometimes things seem to be going really well, almost with no effort. But I guess from our point of view, we just have to be pretty watchful that that's not just a little kind of trap, I guess, for want of a better word, that people are in, and that it's not just kind of delaying eventual psychological stressors that might come to the fore at the end.
Yeah, because I think there's such a sense of failure because they've battled with this on and off, different diets and, weight, etc. And so we don't want to set people up for more failure after surgery because that's often the last resort, isn't it? So just to finish up, just any final words or comments for listeners that are perhaps feeling like they're in a bit of a rut, they're resonating with what we're talking about, they know perhaps that they're, they've gone a bit off track, regained weight, maybe some sabotage going on. What final sort of message do you have for those listeners out there?
Well, maybe I'll speak to two things. I'll talk about patients who are considering surgery and those clients of ours or anyone's who have had surgery. First of all, if you're considering surgery, I guess the biggest psychological stressor that I see or that patients talk to me about is that fear of failure, which you mentioned. Having done, almost everyone's done every single diet under the sun by the time they come to see the surgeon. Some have had wonderful success, but almost always the weight maintenance piece is the difficult bit. People are really, really stressed out about whether they'll fail surgery and not lose weight with surgery, which, must be a hugely confronting thing. So from a physical perspective, I always say that the likelihood of not losing any weight after surgery is incredibly small, incredibly small. However, keeping weight off in the long term really is where kind of having a good team around you, having a supportive network and long-term follow-up really comes to the fore. So for people considering surgery, please keep in mind the short term but also the long term as well. For those post-surgical patients, the message would be, as we talked about earlier, just keep in touch with your clinic. Surgery, dietetics, psychology, none of it, unfortunately, is a one-stop shop. Obesity does cause some changes to your body that persist, so we do treat it like a chronic disease. Keep in touch with your team, make sure your diet's spot on. If there are any sort of psychological red flags that you personally identify or that your team identify, just pop in, have a conversation, get checked out. Solving problems early really is much better than waiting until they become big problems in the long term.
I have a bit of a saying, which is the time to seek sort of psychological help was yesterday and the next best time is today. The longer you leave it, the more you get in the rut. We know what that feels like. And so, I really encourage anyone that is in that situation to please, there is hope. You can change. Every single person here that is listening can change. That's what it means to be a human being, and to please reach out for that help. So thank you so much, Michael. You're our first surgeon guest on the podcast, and we've got listeners from all around the world, pre-surgery and post-surgery, that really appreciate having these frank and honest discussions about, the highs and lows on this journey. So thank you, and I really appreciate your time and your contribution here to the podcast.
Thanks, Georgie. Absolute pleasure. And if there are any particular questions that you or your clients would like to have more information about, please get in touch.
Thanks very much. If you loved the content in this podcast, you have to come and check out my one-on-one coaching program. We work together for 3 months to get you back in control and change your relationship with food for good. Now, I only have limited places available every month, so go to my website and click Work With Me. That's www.georgiebeams.com. See you over there.